wonder if the mic is even tripping on you. I'm gonna just go ahead on. Okay, alrighty then. I wanted to come on and talk about pertussis or whooping cough. Let's get right into it. And let me just go ahead on and share my screen right quick. I'm not gonna be on here long. Okay, let's get up on out of here. All right, so I wanted to bring to your attention if you live in the NYC, my child was exposed to the whooping cough for over a month. Okay, from 5'6" to you see 6'6", 19. So not only is measles going around, pertussis is going around. Pertussis is the whooping cough. Okay, pertussis, also known as the whooping cough, is a highly contagious bacterial illness. It causes a severe cough that can last weeks, even months. Okay, it leads to coughing fits and or vomiting. Pertussis is easily spread from person to person, coughing or sneezing. Anyone can get pertussis, but it can be very dangerous for infants, pregnant women, and people with weakened immune systems. I've talked to you about that before. Family members with pertussis, especially mothers, can spread pertussis to newborns. People are at risk for getting sick up to 21 days after being exposed. So my child has will have to pass through these an extra 21 days as far as I'm concerned, just to make sure she's not sniffling, making sure, she's getting the right type of fruits and veggies to help, boost that immune system, and just making sure that she doesn't get any illnesses during that time period. That's what I'm looking out for. Her immunizations are up to date. Immunizations are very important. There's a big debate going on over immunization causing autism. Now, people needed commonality. So when you're looking at children, I think it's I don't want to, let me not get the data mixed up, but you have a lot of boys. Let's say let's say 6 out of 10 boys or something like that. I'm pretty sure that's incorrect, but as an example, I'll say 6 out of 10 boys and maybe 2 out of 10 girls. And that's escalated. I personally just believe that they didn't understand autism, and a lot of people got misdiagnosed way back when. But what people were looking for were commonalities. So they blamed immunizations for the spike in autism. Now, what I will tell you is this: I don't know if that is the case or not, but I encourage parents, if you're a new parent and your child has to get immunized, which is very important. Immunizations are important because they protect you. You can die from pertussis. Okay, so what I would advise is you to get those shots broken down. Do not allow them to give your baby what they refer to as a cocktail, because that is a mixture of vaccines that they are injecting all at once. What you can ask your doctor to do is to break those immunizations down. And if you have to take your child to the doctor week by week, that's what you do. Ask for those, demand, because they can't tell you that they have to give your baby all of those shots at once. They're giving your baby maybe like 4 different immunizations in one day. So that could be causing an effect. That, I don't know if they looked at that, but that's something that they should look at. Also, the other thing that everyone has in common is the newborn screening. And that is where that started in 1992. And I remember that because that was the year that I had my first child. And that is the year that they started the newborn screening. And that's basically when your baby comes back to you with a tiny, tiny hole and they're on the sole of their foot, on the heel of their foot. Okay, it's a very tiny hole. You're not there when they do it. When they take your baby away from you, that is when they perform that procedure and they give you this pink slip. Okay, again, that started in 1992. You're not there when they're performing that, so we really don't know what goes on. They say it's to determine, illnesses for the future, in your child or something like that. But, who knows? They have all of those tissues and they've never really produced any kind of study or any type of information from those newborn screenings. Okay, but it's definitely important for you to get your child to have immunization shots. You see, the measles have broken out here in New York. There's a case of the mumps in a what do you call those? What do we call those? Holding facility for inmates. There was a reported case of the mumps, and now pertussis. This was just one school. I'm not trying to scare people, but if one person has it and they expose other people, then that's all it takes. You cough in one area, this person gets it, they go somewhere else and cough, the next person gets it. Now these people are going to affect groups of different people, and now you're going to have a cluster of people from different areas with this disease. You may want to consider, if your child is taking the train, public transportation, investing in some of those face masks. And they're not going to want to wear them, but maybe if you explain the situation to them, you can bring them here to this video. I wanted to also share with you. I just want you to get a glimpse of what it sounded like. Now, I'm not going to mute my mic, but you can come back to this. You see, it says the big bad cough, whooping cough. So I'm going to try to play it. I'm not going to even mute my mic because I don't even want to go back and forth with this, with Google. I don't want to play games with them. So I'm going to just play it. And if you don't hear it, come back here so you can get an idea of what it sounds like. Okay? Okay, so if you didn't hear it, just come back here. And that's what it sounds like, when a person has pertussis. That was a baby. But the same thing for an adult. It's like you're fighting for air. And you get those long pauses of, gasping. Like that. If you know anybody with COPD, it's something similar to that. Okay, so like I said, immunizations are important. You should definitely go out and get your immunization shots. Do not let Jennifer Beal and all these celebrities coming out convince you that you don't need immunization. I don't know what's going on, guys. I really don't know what's going on. I find it very odd that all of these illnesses are breaking out in New York. I don't think it's the act of God. And I know in the Bible, it said critical times hard to deal with pestilence and disease will be among us, but it seems like this is being manipulated. That's just my personal opinion, and I'm not pointing at anybody. But it seems like it's this push to not get your child immunization shots, and this big fear of autism, and that's what's causing it. When they really don't know, we don't know what it could be. The food, it could be a lot of things. I know class separates people, but we all drink water, we all buy certain things. So let me go. I gotta go. This is Ray Ray. Bring the witness to you. Coming. Goodbye. Just shut this down.